everyone, welcome back to Melody's 15 years of ocular melanoma. We are going from start to finish through the last 15 years with Melody. And in this episode, we're going to talk about understanding ocular melanoma, what ocular melanoma is from a patient's perspective, what she knew versus what she knows now, and misconceptions and some other topics. So let's get into it. Hello, Melody.
Hi, thanks for having me back.
So let's talk about what is ocular melanoma. For someone who's new to the diagnosis or maybe doesn't understand it, give us sort of a nutshell version of what is it?
So, ocular melanoma is cancer of the eye, but it's melanoma of the eye. So, there are other cancers in the eye, but they're not melanoma. So, ocular melanoma is a melanoma in or on the eye. It consists of conjunctival melanoma, which is on the surface of the eye. It's still considered ocular melanoma, but it's on the conjunctiva, which is on the surface. It's a lot easier to be seen. Those are the melanomas that can look like a birthmark or a red raised growth. It's not the same as a squamous cell or a basal cell that's on the eye or the eyelid. Those are two completely different things. The other type of ocular melanoma is the kind that's inside the eye, and that's the type I had. It usually involves the retina, can have some vision distortions, and that is choroidal melanoma. And then there is also ciliary body melanoma that is closer to the front of the eye. It's still inside the eye. And then there's iris melanoma, and that is the melanoma that grows on the iris. You can usually see that as well because it's a little bit of a color distortion, some black freckling or black dots into the iris, and that is the melanoma that's growing in the iris area. All of those together are ocular melanoma, but they all are distinct based on where they're growing at. So we use the term ocular melanoma as a catch-all for any melanoma that is involved in or on the eye.
Okay, and what did you know about it when you were originally diagnosed, when they first told you?
Nothing. I had
Very
worn
good.
glasses. No, I had worn glasses since I was 10 years old. Nobody had ever said anything about anything I had going on inside my eye. Nobody said I should be watching for something in my eye. It was just, go in and get glasses and leave. So I didn't know anything about any eye diseases.
Right. And then when you were first getting into the diagnosis and kind of learning, how long did it take you to learn, not obviously not as much as you know now, but kind of learn everything you felt you needed to know?
A long time because it's when you're first diagnosed, you get that shock. You're like, what the heck is this? How do you get cancer inside your eyeball? It's like it just doesn't compute with you. And then you start picking things up because they keep using the same phrases like um, ocular melanoma, uveal melanoma. Uveal melanoma is the inside parts of the eye. And it took me a long time to understand the differences that while they were distinctively different, it all was a catch-all bucket of ocular melanoma. So the terminology was a little harder for us for a patient to grasp. You're like, well, what is it exactly that I have? I mean, conjunctival is pretty easy, iris is pretty easy, but when it goes in the inside, okay, I have uveal melanoma. Where is it? And because there's a lot of different parts of the eye that most of us don't even know because it's not really covered in anatomy in school. You got an eye, and you got a retina, and you got a pupil, but other than that, all these other pieces and parts, you're like, well, I don't know anything about that.
Right. Yeah, it's very true. And
Yeah.
then, there's a lot of medical terminology aside from just the anatomy that you're learning.
Well, there's and all the testing that goes into it that you don't even know that it's even possible, like to do like an ultrasound on the top of your eye. They told me they were going to ultrasound my eye, and I'm like, you can't do that. Don't touch my eye. And they're running this little ultrasound wand over the surface of your eye, and it's kind of a freaky thing because I don't know, most people my age at least were told not to put anything in your eye. Don't stick anything in your eye. It's bad. You know, um, it was a bad thing to have a needle or anything stuck in your eye, and now all these people are doing all these things to your eyes, and it's very concerning because it's your eye. And this is going to sound funny, but this is what I kept thinking: that my eye was going to deflate. And I don't know why, but I kept having this mental image of my eye deflating. And like if you stick it, it's going to go whoosh, like a flat tire. And
Like a beach
obviously that's,
ball.
yeah, exactly. But that's not true, but that's where my brain went. It's like, well, you can't do that to my eye. It'll go, phew. Then it will have an eye, and then what will I do? And they're like, that's ridiculous. Well, so go back to cartoons. What happens to people's eyes when in cartoons? When something happens, their eyes, I mean, they don't melt in a gory way, but you've seen cartoons where their eyes
Yes.
kind of, that's where my brain went.
That's funny. So, okay, let me just pause you real quick. When they did the ultrasound of the eye, they do it on your open eye, like on the actual eyeball?
I've had it done both ways. I've had it done through the eyelid and I've had it done on the actual open eyeball. They have this they have these clamps. Okay, so let, you're laying back in a chair very much like a dentist chair, okay? And they put your head back and they have these little metal clamps that they put in and it reminds me because I'm visual, it reminds me of those Halloween Dracula teeth that
Yeah.
do that, except it's metal and it does kind of look like that. And they stick it in and it holds your eyelids open. So you can't blink. Your eye is just open and your eyeball's just kind of hanging out there. And they put some drops in that numb the surface of your eye. And then they do the ultrasound on that way. Sometimes they do it, they'll have you close your eyes and do it through the eyelid.
I always assumed that they did it through the eyelid, so that's fascinating. I did not know that.
It's pretty freaky. In the
Yeah.
beginning, you want to start rubbing something over the eye. I'm like, ooh, I don't think I like that. Yeah.
Yeah. Oh, that's crazy. Okay.
Who would have thought that they can put something in an IV in your veins, and then they can run a test on your eye to see the blood vessels in your eye. It's called a fluorescein angiogram. And they do. They put that's one of the testings that they do to find out if it is ocular melanoma. Is they give you an IV and they inject some dye and they wait a minute and then they do some little magic and they can see the blood going through all the blood vessels and all the stuff in your eye. And so that I had never heard of that. Didn't know it was possible. Had no idea um, that they could do that. There's also them taking the photos. The photos can be a lot because they take a lot of them. So you're looking in the machine and you have to blink but not blink. And, the testing going through the process is kind of intense. It's not, yes, they look in your eye and they say, yes, you have an ocular melanoma, but they have to back it up with all these other tests. So they have to do the photos, they have to do the ultrasound, they do the fluorescein angiogram, they do all of these things to definitively diagnose, yes, it is an ocular melanoma. And each one of those I'd never heard of before.
So when they first diagnosed you, did they tell you which treatment you were going to have right off the bat?
Yeah, I wasn't given any options. I was told I was going to have plaque brachytherapy, and it's a little disc, a gold disc with radiation seeds implanted, and they put it on your eye. I wasn't given any other options. There were options available, but a lot of that goes back to where I was located and my insurance. That my doctors didn't give me any disservice. They didn't hide anything from me. It's just that was what I was available to receive. There was
Sure.
no. I just didn't have an option. So the brachytherapy is pretty much the standard in the United States and other parts of the world as well because it's kind of the oldest and it's very well proven to work. There's proton beam, and then there's some other tests. There's some other treatments as well that aren't as popular. So proton beam would be the next most popular treatment for it. I don't know that I would have qualified for it because you have to qualify for some of the other treatments. The brachytherapy, they can pretty much put that on anybody. They even have one that's notched that can go on the optic nerve, around the optic nerve. So that is the most common and the most used.
Okay. So Let's talk about initial fears because obviously cancer's scary enough, much less having something put in your eyeball, especially something as big as a plaque and radiation. So let's talk about what did you feel like when they told you, and how did they tell you?
They told me that that this was my treatment, that they would sew it in my eye, and I would, because I was close to the hospital, I could go home with it in my eye. I had to stay away from anybody that, especially children, pregnant women. I had to stay 6 feet away from everybody. And that's pretty much all they had said. Um, in the initial, talk about this. After they decided this is what they were going to do, I had to go meet with the radiologist who was going. They through magic of mathematics, they decide how much radiation you're going to get and how long it's going to be there. The ocular oncologist does not decide that. The radiation pathologist does. I think it's a pathologist. He does that. So he's the one who's going to do all the math and work it up and say this is how much radiation you need and this is how many days you need it. Then when they decide, they know how big the plaque is going to be based on the size of your tumor because they've already measured it through through all the testing that you've had done. So they've measured it. They know what size. Then right before surgery was when they told me all the whys and wherefores. So they told me that I had a very diffused melanoma. So my melanoma was the bottom left, kind of towards the back. When they put this on, mine was about the size of a quarter. When they put it in there, it was going to cover the macula of my eye, which your macula is your central vision. So he told me at that time that they were going to have to cut the muscles to put this in, which that freaked me out, I'm just going to say. They're going to slide the plaque in, and that I will most likely lose my vision. And it was all said very matter-of-factly. I didn't say anything at the time, but the thought of cutting my muscles was a little creepy to me because I thought my eye would fall out. Now, I'm a 48-year-old woman. I'm not stupid. But you have all these childhood images that come back to you. And I thought, oh, you cut my muscles. How's my eye going to stay in my head? Because they only cut one, and there's other things that hold your eye in there. Your eye does not fall out. So, but you're sitting in the chair and they're telling you all this stuff, and your brain is just like, pinballing around with all these images that you've seen your whole life that really don't make any sense and they're not real. But this is where your mind goes. Your mind goes to something it knows. There's little triggers that pop up these little images, and oh my god.
That makes me think of Pirates of the Caribbean, the guy that has the eye that always pops out. It goes rolling.
That's what I thought was going to happen. Honestly, I'm an intelligent woman. I'm not, but that is really what I thought. I thought, oh my god, And I went home with the plaque radiation and a lot of bandage packing on it, and I had everybody has something different. When I had mine in, I did not ever take off the bandages or insert any drops or ointment. It was sealed. And when I went in to have it taken off, it was still sealed. And which is a good thing because I thought if I took it off, I really thought, oh my gosh, how is my eye going to stay in my head? I never said anything to my doctor about it because I thought, well, that just sounds ridiculous. But because I went back and forth between the common sense, oh, Melody, you're just being silly, to the fears that just kept creeping up in my head about what was going on with my eye. I was going to have a deflated eyeball that was going to fall out and roll on the floor, and then what was I going to do? So. So there's a couple of different things that happen. You have the part of your brain that understands and knows and okay, this makes sense and this is rational. Then you have the other side of your brain that is not rational, that has all these little fears that gnaw at you, and even though you tell yourself, oh, you're being ridiculous, it's still there. 15 years later, I still remember that feeling of thinking, I'm going to have a deflated eyeball that will fall out. And it's not logical, but that's where your brain is not always logical.
Yeah, I agree with you. I think if I had it all packed and like all concealed, I don't think I would take it off either. I think I would be afraid to
No,
look at it.
no, but there are some physicians that will send patients home with drops and ointment, and they have to every day put drops and ointment in. And I'm grateful that I did not have to do that because I did not want to see it. I did not want to do it. I didn't want any part of that, but I didn't know any better because that wasn't part of my protocol. And luckily, it just stayed sealed until I had to go in and get it taken off. So I was grateful for that. It worked out better for my mental health.
What was your pain like with it?
So I couldn't lay down. So if I tried to lay down, my head just throbbed. I felt like it was just going to explode. So I slept in a reclining position, like I slept on the couch, kind of sitting up ish. And if I sat still and didn't move, I didn't have any pain. If I tried to watch television, and television can be bad for some people depending on where their plaque is, because you can't help but your eye tracks, and the television moves very quickly, so your eyes constantly tracking, and it would pinch and it would throb and it would hurt really badly. So I sat there with my eyes closed and tried really hard not to move my eyes. And as long as I did that, the pain was tolerable. I could handle it with Tylenol. Getting up, walking around was difficult because you want to look where you're walking. You feel unsteady. You've gone from two eyes to one, and monocular vision is a lot different. So you feel a little unstable. You feel like, you don't really have control. Some people, I shouldn't say everybody, but that's how I felt, and I've heard other people say the same thing. So I stayed in a very small area, and I didn't move around much, and it was okay. But there were times when the pain was more than I wanted, and I did take pain medicine for it, uh, because it was just kind of an ache, an aggravating ache in there. But when I would move my eye, and I would get those excruciating shooting pains from the plaque was basically pinching. The muscles just kind of in there, and it's not attached to the eye anymore, and things aren't where they're supposed to be. So I would get these very intense pinches that were very painful. So, but for the most of the time, it was tolerable. It was like a dull headache.
Do most people get their eye cut or is it kind of just dependent?
It depends on where they have to put the plaque. Not everybody gets the muscles cut. It just depends. Some people get both muscles cut. Some people don't have any. The really tricky thing with this cancer being in your eye, it depends on where the ocular melanoma is in the eye, depends on where they put the plaque. And some locations, the radiation doesn't destroy the vision. Some places they don't have to cut the muscles. It just all depends on um, the location, how big the plaque is, how much radiation is in there. So there's all these variables. So where mine was and how I felt is not always transferable to somebody else.
What about the fear of the radiation itself? Because you're being told that you have to stand 6 feet away from another person, but it's in your head.
It's very
Like, what
scary.
about your own brain and your other eye? And how did you feel about that?
Well, we go back to the melting eyeball. That's where my brain went. My eyeball is going to melt. This can't. How can it handle this? But I have never been able to get a good answer as to why I have to be 6 foot away from somebody. But this is in my own brain, but it's not affecting my head in any way.
Yeah.
I don't have an answer for that other than, to me, it was very scary because I thought I was going to melt my brain. I might have brain damage. I thought, oh no, what else is it doing in there? But it has been proven to be very safe, and it does not affect the brain. It does not affect your teeth. It does not affect other things. And it does not hurt your eye. That's why there's a limit on how much radiation they can give to your eye. I don't understand why people have to be 6 feet away from you. I think it's just a precaution because it's radiation. But honestly, the amount of radiation in your eye isn't enough to cause any damage to a brain or to the surrounding tissue. 15 years later, my brain is the same as it was then, which is neither good nor bad. But I don't. I haven't had any problems with anything surrounding, and I had a fairly large plaque. They've done larger, so I mean I was kind of in that middle ground. So I it hasn't affected anything. Some people think it affects their teeth, but it doesn't, and because you would have to have your plaque facing downward, and mine was in the back, more so facing outward. So it was shooting out. Though not shooting, there's no shooting, but the direction of the radiation was pointing out of my eye, not into my head or in any way. So I just that's why they tell people to stay 6 feet away. Is I think just because of it coming out of the eye. But I really don't have an answer for that.
Yeah, that's so interesting. Like the way that they figure out what they can do and how they can do it safely is just really fascinating.
Well, they had to do it with trial and error, which is really scary because I would hate to be the person that was on the trial. But they did the trials on the. It's called a COM study. It was done in the 80s, and if you want to go read on that's pretty fascinating to read. But they experimented with how much was enough, and they keep tweaking it. They keep looking and saying like what if we use less radiation? So they're constantly working on exactly how much radiation is needed to kill the tumors and keep the eye as healthy as possible.
So crazy. So how many days did you have your plaque on?
5.
5. And then when you went in to get it taken off, what was that like?
Relief. Um, you go in just like they're gonna. I went in. I had regular surgery in their surgical suite. I was under general anesthesia. Some people are not. Depends on your physician and uh, your hospital or treatment center. Some of them use a twilight sleep. I was 100% out. So I had to go through the anesthesia recovery process, and honestly, that was tough. I don't do well with anesthesia. We've discovered I'm a hard one to wake up, and it takes a while for me to get it out of my system. They want you up and moving, and I'm sleeping. And so, and I say crazy things and do crazy things. Nothing, just silly stuff that they laugh at. But the anesthesia part was tough. But once they took the plaque out. Now I hadn't been anywhere in 5 days. Went to the hospital, checked in, had my plaque, went home, sat on the couch. I went in, got it taken out, and I'm ready to go. And I'm like, whew, I'm free. So the first thing that we did was we went and had lunch. And I felt like I could be normal again. So that's all I could tell you. It was relief. My eye didn't really hurt anymore. It wasn't comfortable, but my eye wouldn't open, so I was going around with my eye closed, and I didn't care. I just wanted to be normal again. I wanted to go shopping. I wanted to go out to eat. I just wanted to be in the world again because I was not the type of person who liked to be at home for 5 days and not able to go anywhere. So that was a hard part. I didn't feel like going anywhere, but after the plaque, I just felt like I was me again.
Yeah, that's totally understandable. I mean, I feel like that sometimes after I have a cold,
Yeah.
you know? Like,
Okay. You just feel,
oh, I have energy again. I can go do things. I'm a person again. So
yeah.
I can only imagine.
Yeah. You feel like, oh, it's behind me. I'm done. Huh. I'm
Hmm.
human again. I feel like me again, and I just want to be normal again. And that's kind of the direction I went. Let's just go do something normal. Last place I wanted to go was home.
And how long did it take after the procedure before you got some kind of results as to whether it worked or how well it worked?
It takes a long time because you have to go in and be monitored. So I had the plaque out. I went in the next week. They looked at it. Everything looked fine. And then I went in for my regular scheduled appointments. And they were every 3 months. And they just monitored the growth every 3 months to make sure that it was doing well. And mine was shrinking and it was doing well. And so then after 1 year of every 3 months, I graduated to 2 yearly. So it's a multiple months of watching to make sure that there is no regrowth.
And what are you on now? Is it still yearly?
It's yearly, yeah.
Yeah, okay. All right, everyone, that's all for this episode. Please stay tuned because we will bring you lots more episodes this year. We're going to talk to Melody all throughout this year about her 15-year journey. So please stay tuned for next episode. We'll see you then.